welcome back to my channel Agape Vlogs. I am back again with the remaining part of test 2. As you know, the Nursing and Midwifery Council test of competence, that is NMC test part 1 exam, is a computer based test that is usually termed as CBT, consisting of 120 multiple choice questions for 4 hours. NMC CBT is intended for nurses trained outside the European Union and European Economic Area seeking employment as a nurse in the UK. So many of you have subscribed. Thank you all, and thanks again for the lovely comments you guys are posting. Wish Andrew Catalan a very successful exam. As he has mentioned that he's taking his exams. I have already set a series of questions for test 1. I have divided into many series, 3 series I believe, or 3 series, and apart from that, for test 2 I have started the next series, and that had another 15 questions, and the remaining possible questions I will include in this video. Please do watch. Once again, thanks all the new subscribers who have walked into Agape Vlogs recently. And please share with your friends if you find these videos useful, and do give me a feedback. The more feedbacks I get, the more encouraged I am to do my next video. Question number 16 of test 2 part 1. Question is, normal heart rate for 1 to 2 year old is, options are option A 80 to 140 beats per minute, option B is 80 to 110 beats per minute, and option C is 75 to 115 beats per minute. So please note your scores, and later on do sum up all the scores and see where you stand. Okay, so what is the answer to this question? I have asked for a 1 to 2 year old baby's normal heart rate. Could be none other than 80 to 110 beats per minute. That is, the second option is the right answer. Question number 17. In the news observation system, what is AVUP? Options are option A, a replacement of GCS, option B, an assessment for confusion, and option C, assessment for the level of consciousness. So what is the answer you have got? So friends, guess all of you got the answer right. The answer is assessment for the level of consciousness. That is option C. In the context, the question is in the news observation system. What is news? What does news NEWS stand for? It is abbreviated form of National Early Warning Score. Question number 18 is, which bag do you place infected linen? Options are, option 1 is water soluble alginate polythene bag before being placed in the appropriate linen bag, no more than 3/4 full. Option B is orange waste bag before being placed in the appropriate linen bag, no more than 3/4 full. Option C is white linen bag after sorting, no more than 3/4 full. The right answer is water soluble alginate polythene bag before being placed in the appropriate linen bag, no more than 3/4 full. That is, the option A is the right answer. Got it? So let's move to the next question. Question number 19. Which one of these notifiable diseases needs to be reported on a national level? Select 2 correct answers. Options are, option 1 is chickenpox, option 2 is tuberculosis, option 3 is whooping cough, option 4 is influenza. So you have to select 2 correct answers, and the question is, which one of these notifiable diseases needs to be reported on a national level? So the right answers are option B and option C, that is tuberculosis and whooping cough. Question number 20 is, patient is post of repair of tibia and fibula. Possible signs of compartment syndrome include option A, numbness and tingling, option B is cool dusky toes, option C is pain, option D is toe swelling, and option E is all of the above. So tibia and fibula repair. So the possible signs of compartment syndrome could include all of the above. That is, the last option is the right one. All of the above is right answer. So moving on to the next question, question number 21. Patient developed elevated temperature and pain in the loin during blood transfusion. This is indicative of option A, severe blood transfusion reaction, option B, common blood transfusion reaction. Option A is the right answer. Patient developed elevated temperature and pain in the loin during blood transfusion. This is indicative of severe blood transfusion reaction. Got it? Severe blood transfusion reaction is the right answer. And moving to the next question, what is the best position in applying eye medications? Options are option A, sitting position with head tilt to the right. Option B, sitting position with head tilt backwards. And option C, prone position with head tilt to the left. So imagine yourself as a patient or as a nurse and get to the answer right away. The answer will be option B, sitting position with head tilt backwards. That's the right answer. So let's move on to the 23rd question. Which of the following is at a greater risk for developing coronary artery disease? Option A, male, obese, sedentary lifestyle. Option B, female, obese, non-sedentary lifestyle. So the greater risk for developing coronary artery disease, the right answer is male, obese, sedentary lifestyle. So option A is the right answer. Got it? And let's move on to the 24th question. Most commonly, aneurysms can develop on. So here also you have to select two answers. The options are option A, abdominal aorta, option B, circle of Willis, option C, intraparenchymal aneurysms, option D, capillary aneurysms. Commonly aneurysms can develop on. The right options are option A and B, that is abdominal aorta and circle of Willis. Okay. Most commonly aneurysms can develop on abdominal aorta and circle of Willis. Okay, so option A and B is the right answer. Let's move on to the 25th question. On assessment of the abdomen of a patient with peritonitis, you would expect to find option A, rebound, tenderness and guarding, option B, hyperactive, high-pitched bowel sounds and a firm abdomen, option C, a soft abdomen with bowel sounds every 2 to 3 seconds, and option D, ascites and increased vascular pattern on the skin. Option A, rebound, tenderness and guarding is the right answer. To the question, on assessment of the abdomen of a patient with peritonitis, you would expect a rebound, tenderness and guarding. Okay, abdomen tenderness and guarding. So let's move on to the next question. Question number 26. Patients with gastric ulcers typically exhibit the following symptoms. Option A, epigastric pain worsens before meals, pain awakening patient from sleep and melena. Option B, decreased bowel sounds, rigid abdomen, rebound tenderness and fever. Option C, boring epigastric pain radiating to back and left shoulder, bluish grey discoloration of periumbilical area and ascites. Option D, epigastric pain worsens after eating and weight loss. The question was, patients with gastric ulcers typically exhibit the following symptoms, and the last option is the right one, that is epigastric pain worsens after eating and weight loss. So, patients with gastric ulcers exhibit epigastric pain after eating, it worsens, and also weight loss. Okay, got it? And let's move on to the 27th question. Under the yellow card scheme, you must report the following. Here also, you have to answer you have to pick two answers. The options are option A, faulty brakes on a wheelchair. Option B, suspected side effects to blood factor except immunoglobulin products. Option C, counterfeit or fake medicines or medical devices. So, the correct options are option A and C. Under the yellow card scheme, you must report faulty brakes on a wheelchair and counterfeit or fake medicines or medical devices. We are asking, what is yellow card scheme? Yellow card scheme in the UK system, it's for collecting information on suspected adverse drug reactions to medicines. The scheme allows the safety of the medicines and vaccines that are on the market to be monitored. Question number 28. The degree of injection when giving subcutaneous insulin injection on a site where you can grasp 1 inch of tissue. Options are 45 degrees, option B 40 degrees, option C 25 degrees. Option A 45 degrees is the right answer. Coming to the 29th question, a patient suffered from stroke and is unable to read and write. This is called option A aphasia, sometimes called dysphagia, option B dysphagia, and option C partial aphasia. When the patient is unable to read and write, it is medically termed as aphasia. Dysphagia is the difficulty to swallow, and aphasia is the inability to use the language, written or verbal. 30th question. Hypoglycaemia in patients with diabetes is more likely to occur when the patient takes. Select 3 correct answers from the following options. Option A, insulin. Option B, sulfonylureas. Option C, prandial glucose regulators. And option D is metformin. So the correct answer is option A, option B, and option C. That is, you have to avoid metformin. Next, question number 31. Listen to the question carefully. Patients with gastrointestinal bleeding may experience acute or chronic blood loss. Your patient is experiencing hematochezia. You recognize this by options are option A, red or maroon colored stool rectally. Option B, coffee ground emesis. Option C, black tarry stool. Option D, vomiting of bright red or maroon blood. So here your patient is experiencing hematochezia. What is hematochezia? It's a passage of fresh blood through the anus, usually in or with stools. So the first option will be the right here, that is red or maroon colored stool rectally. That's going to give you the right option. Okay. Let's move on to the 32nd question. The worst advice you can give a student nurse with regards to the use of social networking sites like Facebook. There are 2 right answers in this. Option A is do not identify yourself as a nurse. Option B is do not engage in a personal discussion or relationship with a patient or former patient. Option C is do not post a picture of patient's child even if they allow you to. And option D is you can rely on the site's privacy settings. So the worst advice you can give a student nurse with regards to the use of social networking sites like Facebook, the correct answer is the worst advice. Mind you, it's the worst advice. Option A, do not identify yourself as a nurse, and you can rely on the site privacy settings. That they are the worst advice you can give a student nurse with regard to the use of social networking sites like Facebook. Moving on with the 33rd question. It is unsafe for a spinal tap to be undertaken if the patient, options are, has bacterial meningitis. Option B, papilloedema. Option C, intracranial mass is suspected. Option D, site skin infection. Option E, all of the above. Very obvious answer, all of the above. That is, option E is the right option. Okay. Next, moving on to the 34th question. On physical examination of a 16-year-old female patient, you notice partial erosion of a tooth enamel and callus formation on the posterior aspect of the knuckles of a hand. This is indicative of options are option A, self-induced vomiting and she likely has bulimia nervosa. Option B, a genetic disorder and a sibling should also be tested. Option C, self-mutilation and correlates with anxiety. Option D, connective tissue disorder and she should be referred to dermatology. So the right answer is self-induced vomiting, and she likely has bulimia nervosa. So option A is the right answer. It can also come across Russell's sign. It is a sign designed as calluses on the knuckles or back of the hand due to repeated self-induced vomiting over long periods of time. So in this question, you can find the patient is having calluses on the posterior aspect of the knuckles of the hand. So it is the right option is self-induced vomiting, and she likely has bulimia nervosa. I guess you know what is bulimia nervosa. Do you know? I don't think I have to explain it, but still I will. It's an eating disorder characterized by binge eating followed by purging. Binge eating refers to eating a large amount of food in a short amount of time. Okay, so let's come on to the next question, that is the 35th question. In a community hospital, an elderly man approaches you and tells you that his neighbor has been stealing his money, saying, "Sometimes I give him money to buy groceries, but he didn't buy groceries and he kept the money." What is the best course of action for this? Option A is raise a safeguarding alert. Option B is just listen but don't do anything. Option C is ignore the old man, he is just having delusions. Option D is refer the old man to the community clergy who is giving spiritual support. So it is a community hospital, and he approaches you and tells you that his neighbor has been stealing his money, and he's saying that sometimes I give him money to buy groceries, but he didn't buy groceries and he kept his money. So the best course of action you can do is to raise a safeguarding alert. That is option A is the right answer. Okay. Question number 36. Prothrombin time is essential during anticoagulation therapy. In oral anticoagulation therapy, which test is essential? Option A, activated thromboplastin time, that is the partial thromboplastin time PTT test, is a blood test that is done to investigate bleeding disorders and to monitor patients taking anti-clotting drug, that is heparin. And option B is international normalized ratio, that is the PT or the prothrombin time test, standardized as the INR test, is most often used to check how well anticoagulant tablets such as warfarin and phenedione are working. So prothrombin time is essential during anticoagulation therapy. In oral anticoagulation therapy, which test is essential? Second option is the right answer, that is the PT test. The prothrombin time test is essential. Going on to the 37th question. Conditions producing orthostatic hypotension in the elderly. Options are option A, aortic stenosis. Option B, arrhythmias. Option C, diabetes. Option D, pernicious anemia. Option E, advanced heart failure. Option F, all of the above. So conditions producing orthostatic hypotension in the elderly, all of the above is the right answer. Okay, got it? And let's move on to the 38th question. Waterloo score of 20 indicates what type of mattress to use. So you can select two answers. First is standard specification form mattresses. Option B is high specification form mattresses, and option C is dynamic support surface. So Waterloo score of 20 indicates high specification form mattresses and dynamic support surface. So option B and C are the right options. I guess I'm running rather fast. I want you to get all the questions. That's why question 39 is enteral feeding patient checks patency of tube placement by option A, pulling on the tube and then pushing it back in place. Option B, aspirating gastric juice and then checking for pH lesser than 4. And option C, infusing water or air and listening for gurgles. Option D is X-ray. So question is internal feeding patient checks patency of tube placement by option B and D are the right answers, that is aspirating gastric juice and then checking for pH lesser than 4 and X-ray. Two answers are the right answers. Two options, you can pick two options in this. they are the correct answers. Okay, so listen to the next question very carefully. 40th question. It appears simple, but you have to understand the question properly. A patient is assessed as lacking capacity to give consent if they are unable to. Options are: option A, understand information about the decision and remember that information. Then he is assessed as lacking capacity to give consent. Option B is use that information to make a decision. Option C is communicate their decision by talking using sign language or by other means, and all of the above. So if he's unable to understand information or use that information to make a decision or communicate their decision, so all of the above is the right answer. Okay, 40th question, D is the right option. Coming to the 41st question, proper dressing for wound care should be. Select 3 answers in this question. Option A, high humidity. Option B, low humidity. Option C, non-permeable or conformable. And option D, adherent. Option E, absorbent or provide thermal insulation. So option A, C and E are the right options. Proper dressing for wound care should be for high humidity. Option C, non-permeable or conformable, and option E, absorbent or provide thermal insulation. So these are the right options, A, C and E. Okay, and moving to the 42nd question. You are monitoring a patient in the ICU when suddenly his consciousness drops and the size of one of his pupils becomes smaller. What should you do? Options are: option A, refer to neurology team. Option B, continue to monitor patient using GCS and record. Option C, consider this as an emergency. Prioritize ABC and call the doctor. So what is the right option? Option C is the right option. You have to consider this as an emergency. You have to prioritize ABC and call the doctor. Okay. So 43rd question. Patient is post-op liver biopsy, which is a sign of serious complication. Here you have to select 2 correct answers. Options are CR of 104, RR of 24 and temp of 37.5. Option B is nausea and vomiting. Option C is pain. Option D is bleeding. So the question is, patient is post-op liver biopsy, which is a sign of serious complication. So when he is post-op liver biopsy, a sign of serious complication would be nausea and vomiting or bleeding. These 2 should be considered as serious complications. Okay, in a patient who is status post liver biopsy. Okay, and question number 44. Enteral feeding patient checks patency of tube placement by. Select 2 answers. Option A, pulling on the tube and then pushing it back in place. Option B is aspirating gastric juice and then check for pH less than 4. Infusing water or air or listening for gurgles. X-ray. So I know I have given this question earlier. Is it a mistake or what? Yes, the 39th question is similar to the 44th question. So anyways, you know the answer. Answer is option B and D. That is aspirating gastric juice and then checking for pH less than 4 and X-ray are the right options. Okay. So coming to the 45th question. Nurse is teaching patient about crutch walking, which is incorrect. That is, options are take long strides. Option B is take small strides. Option C is instruct to put weight on hands. So the nurse here is teaching patient about crutch walking. Which is incorrect is take long strides. Okay. Okay. And 46th is question is, what advice do you need to give to a patient taking allopurinol? You can select 3 correct answers. So the advice you need to give to a patient taking allopurinol, there are 4 options. Option A is drink 8 to 10 full glasses of fluid every day unless your doctor tells you otherwise. Option B, store allopurinol at room temperature away from moisture and heat. Option C, avoid being near people who are sick or having infections. And option D, skin rash is a common side effect. It will pass after a few days. So option A, B and C are the right answers. Okay, the options, please check out the options. You can go through the options, and the first option is the right option here for the 47th question. That is, what do you expect patients with chronic obstructive pulmonary disease to manifest? The option 1 is the right one. And moving to the 48th question, as a nurse, what health teachings will you give to a COPD patient? Option A, encourage to stop smoking. Option B, administer oxygen inhalation as prescribed. Option C, enroll in a pulmonary rehabilitation program. Option D, above, all of the above. All of the above is the right option. Option D is the right answer. 49th question, a relative of the patient was experiencing vomiting and diarrhea and wished to visit her mother, who was admitted. As a nurse, what will you advise to the patient's relative? Option A, there should be a 48 hours after active symptoms should disappear prior to visiting patient. Option B, inform relative it is fine to visit mother as long as she uses alcohol before entering ward premises. So what is the right answer? Option A is the right answer. There should be 48 hours after active symptoms should disappear prior to visiting patient. Okay, be it mother or child. Okay. And the last question, we have reached the last question. The 50th question is, for an average person from UK who has non-insulin dependent diabetes, how many servings of fruits and vegetables per day should they take? Options are, option A, 1 serving, option B is 3 servings, option C is 5 servings, and option D is 7 servings. Option C, 5 servings is the right answer. So friends, test 2 part 1, we have completed 50 question and answers. We have divided it into 2 sessions. The first session I have posted earlier last week, and this one the remaining questions. I hope I can be back before the exam with many more questions if possible, and wish all of you good luck and give me your feedback. It can trigger my next post very fast. Okay, so if it has been useful, please do give me your comments, and if you wish some more improvisations in the video in my post, do tell me. You're free to tell me. And all for subscribing Agape Vlogs, for watching my videos. Thank you all for sharing, and see you all next time very soon. Bye bye.